Hi, my name is Dinesh Simakurti, and we're here today to talk to Dr. Kaushik on a fireside chat with Stasis. We want to understand how Dr. Kaushik has utilized technology in his practice of medical care. Hey, Dr. Kaushik, can you share a quick background on yourself?
I'm a trained clinician. In fact, was done my post graduation in preventive and social medicine and public health. Now I chose hospital administration because it was not just a little of people that I want to cater to. I want to cater to a larger population, and in toto, it's not just treating them and getting them back. It was in toto an experience, and when they're out of the hospital, they had to be cured, they had to be treated. So that was my thing of getting into hospital administration.
So, Dr. Kaushik, I think we met almost 8 months ago, and when we first met, you got to see what Stasis was doing, and you were very excited. You were a champion from day one. Can you share why you were so excited?
Now, as I in fact always wanted to put it in this way, when a patient is out there in the hospital, it's his or her right to have all focus on the patient, on himself or herself. Now, ICU in fact has all those monitors, all those blinking numbers which are there, which confuses the staff there sometimes as well. And that is one spectrum. That's one end of it. And the other end of it, there are wards which has nothing, which has in fact basic things which has to be handled by a human, by a sister out there, coming in, checking the pressures, be whatever. But this idea, this concept of that was in fact introduced by you, fit in exactly. That was the bridge that for the gap that was there between an ICU as well as somebody in the wards out there.
So, Dr. Kaushik, in your last job, you actually got to run a pilot of the Stasis system in your hospital. Can you share any example of how it made a difference in patient care?
Right. Now, there was this 64-year-old woman who was in fact was a known case of chronic kidney disease. Then she didn't have any of her attenders attending to her. They were very difficult to in fact communicate to as well, though the condition was not all that good looking. Mm-hmm. Due to certain constraints, probably they had to be placed in the general wards. Now there was a time when probably in the evening times where she in fact was deteriorating, and nobody could in fact directly pick it up. Probably when the doctor, the consultant came for rounds at a later time in the evening, in fact he was very excited about all these things, this concept as well, and he had to go through the tab that you had provided. Now in that scenario is when they had to pick up, there was a major drop in her pulse rate, one thing, and in fact her SpO2 as well. So in fact that was probably they thought. It was such a time where the moment that happened, she had to be shifted to the ICU for higher intervention.
Well, we're really glad that we're able to make clinical impact. That
exactly.
Is
yeah.
always
I was so happy that such system was there at that point of time. That was there.
So one of the biggest aspects of this is that we were able to identify a problem and use technology to solve it. Instead of having a nurse manually monitor, we have a machine. Where do you see hospitals or Indian healthcare going in terms of technology adoption?
All right. This idea of continuous monitoring of a patient vitals post ICU or probably pre in fact ICU as well. Mm-hmm. That is an impact which will in fact be being felt not just now in the next 1 or 2 years, but of course is what in my experience would be in fact making a lot of impact in the next coming 3 to 4 or 4 to 5 years.
Yeah.
Wherein the mortality rates could probably, as a result happening in the hospitals, in fact could come down as a result of such technology that are being used. One thing. Second thing is also that it makes jobs of certain treating doctors a little easy. Yeah. How much of stress these doctors nowadays are having, and we are answerable to so many things. Mm-hmm. Right. So such technologies that we are in fact having right now could in fact make the treatment aspect for a consultant on a patient a little more on an easier path, rather than him struggling all the time, moving around, taking the inputs of the people. So that is the second point, is what I feel. The third point would in fact be this boosts the confidence of the patients and patient relatives to, in fact, get their relatives admitted into a hospital.
Involving the patient
Exactly.
and the family. Thank you, Dr. Kaushik, for that fantastic understanding of where you think healthcare is going. Technology is a big aspect, and I think it requires a lot of us to think about it every day to know where it's going to actually head. Well, thank you all for joining us for another Fireside Chat with Stasis. Dr. Kaushik, thank you so much for your time.
Thank you so much. No, in fact, I'm overwhelmed, seriously.
Thank you.